how to use a massage gun on shin splints. The anterior tibialis muscle, this is the posterior tibialis. Anterior means front, posterior means back. And in severe cases, if you have the pain here, it could also be two other muscles, and I don't even need to say them. Now, with this one, you may feel pain when you rise on your toes or when you evert your feet, which is turning your feet out. Yeah. Now, both of these types of shin splints are exercise induced. In other words, they tend to feel better with rest, but as soon as you start walking or running, it's also the telltale sign is that you actually have people, you'll go in there and palpate. You'll feel in there, you'll find tender spots.
In the beginning of track season was real common. They haven't been doing anything sedentary, and then you hit it too hard.
You hit it too hard, right? Yep. Exactly. That's one of the common things. But let's say it's point tenderness.
In one spot?
Yeah, one little spot.
Yep.
Like a dime. Then I'm concerned there might already be a stress fracture. Yeah. If you're going to do massage, I would recommend actually doing it before and after exercise,
sure.
Brad. You want to prepare that muscle, make it supple. You can do stripping massage, which is basically going the length of the muscle fiber. You can also, if you find a spot, you can do cross fiber, which Brad will show.
And it may be that stress fracture. Are they still going to do some massage gun?
No.
Okay, then
you got to get it checked out. I'm using a really aggressive one here. That's like the bullet one.
The round one. If you're just starting out, particularly if you're doing the anterior tip, because you got a bone right there.
Right.
I would start with this
or the
air-filled one.
Oops, there we go. Yeah, sure. Let's hit anterior, and I really feel this on me.
Oh, I believe it. Now I don't have any shin splints, but this feels really good. It just feels like I'm doing a nice job. Now, if I go directly on the bone,
right,
it's okay with this air fill. That's the big advantage of it, but you're not going to get as aggressive.
You're not getting that deep, right.
Yeah. But instead of going straight into it, you're going to go sideways. The fibers go up and down. I'm going to go across the fibers.
And that works quite well.
It does. And you can get, close to the bone. I can actually go over it when you're not percussing straight into it. You can really vary your intensity by the angle as well. Like Bob said, work around the tender spot, and as it feels better, you can go over. The first day you may not be able to get into that tender spot. So you're going to work that area, a few minutes, and once you get used to it, and it's doing well, you can go, 5 or 10 minutes. Be careful with your skin. Obviously, you don't want to irritate it.
If you start feeling shin splints, that's where you want to start this massage.
Sure.
Right away. I mean, if it gets too far along, nothing's going to be able to help.
Yeah.